Good evening, everybody, and welcome to another edition of the South Florida Tribune podcast. My name is Scott Morganroth. Glad to be joined by Gary Kornbluh. This broadcast is presented by Senior Medical Associates. Gary, great to have you back on.
Hey, thanks, Scott. So you mentioned Senior Medical, so I always like to start and welcome viewers and listeners. I always like to start by thanking Senior Medical Associates. They're a primary care group in Broward County. They have 10 offices and they're just wonderful. And you can reach them. And remember, they're seniors, so they're for 65 and older. So if you know anyone that's looking for a great primary care center in Broward, these guys are wonderful. And their number is 954-659-9690.
And just so everybody knows, put that card back up there as well, Gary, that they also have, if you want to contact Senior Medical Associates, you can do so at seniormedicalassociates.net as well. So just want to point that out to you as well, folks. So you have the phone number, you have the contact information. With that said, it's time for us to step things up as we get ready to approach Medicare open enrollment period. With that said, Gary, what is AEP?
AEP is the time that comes around once a year. It's an acronym, AEP, and it stands for Annual Election Period. Some people refer to it as Annual Enrollment Period, but it's that one time a year when you can change your Medicare Advantage plan, or you can change your Medicare Part D drug plan. You can also change, do other changes as well. You can change if you have Medicare Advantage, and let's say you want to go, you realize that, original Medicare and a supplement was the better choice. You can actually switch back to original Medicare and a supplement at that point. Basically, the way that would work in a nutshell is as long as you qualify for the supplement, because remember, they're medically underwritten. Once you're out of that guaranteed issue period, supplement plans are medically underwritten. So assuming you're healthy enough to qualify, your agent would then put what's called a standalone Medicare Part D in place for you. That would accomplish two things. We'll give you drug coverage for that new year, for the January 1st of the coming year. And it would also serve to disenroll you from the Medicare Advantage plan. But that's AEP. If you ask what AEP is, that one time per year where you can change plans. In terms of what type of changes you can make, it can be tricky. So just make sure you speak to an agent and they'll give you the proper guidance.
Very good.
Okay. Just so you know, I'm sorry, Scott, I failed to mention the dates. And that's really important. Annual enrollment period, annual election period, AEP starts on October 15th of every year, and it runs to December 7th. So it's that window where you can make that change, October 15th to December 7th. Thank you.
Oh, no problem. December 7th, forever. It's worth is my mom's birthday, my late mother. So, that's one date I'm definitely never going to forget. All right. Yeah. With that said, Gary, if I can make a selection during AEP, then change my mind, can I change my plan?
If you make a selection during AEP, let's say you select a different Medicare Advantage plan. Maybe your doctor left your old plan and you're kind of forced to choose another plan. You can do that, and your new plan would take place January 1st. Okay, now let's say you changed during that annual enrollment period, October 15th to December 7th. Let's say you had one carrier and you were convinced that this new plan was the best plan. And then you had another change of heart, but it was just prior to December 7th. It's still during that AEP window. You could actually change again. You could change, I hate to say this, but you could change as many times as you want. And it's the very last plan that you choose prior to the 7th of December is the plan that actually goes into effect on January 1st.
Very good. Can I change from Medicare Advantage back to original Medicare or vice versa during AEP?
You can. As I'd mentioned previously, you can change from Medicare Advantage as long as you're healthy enough to qualify. You can change back to original Medicare. Typically, the best way to approach it is have your agent write the supplement, because going back to original Medicare, remember, only covers you at 80%, right? So you need that supplement to give you that 100% coverage. So your agent would probably write that Medicare supplement plan, wait and make sure that you're approved first. And then once you're approved, that agent would go ahead and write that standalone Medicare Part D plan, which would then disenroll you from your Medicare Advantage plan. Now, let's say the reverse was true. You had a Medicare, you had original Medicare and a supplement, and again, you had this standalone Medicare Part D plan to cover your meds. And let's say you wanted to go back to Medicare Advantage, you could do that too. The only reason why I've seen in the past why people might do that is because they simply can't afford the cost anymore, because there's a cost associated with having the supplement. But it is, I believe it's the Medicare beneficiary's best choice, because having original Medicare and a supplement gives you access to the entire Medicare system nationwide with no referrals, no network. Whereas the Medicare Advantage plan, remember, they can also be very beneficial because they offer all of the ancillary coverages like the dental, vision, and hearing. But remember, you're also confined to the carrier's network. Could even be a national network, but you're still confined to that carrier's network. You still have to stay within the confines of the network. Whereas original Medicare, you've got the entire Medicare system. As long as that doctor, that specialist, that hospital, that urgent care center, as long as they're as long as they accept Medicare with the original Medicare and a supplement, you're in.
Very good. Okay. Do I have to sign up for Medicare if I have good coverage from my employer?
That's a great question. And I get that often, Scott. And the answer really simply is no, you don't. If you have great coverage from your employer, and let's say you turn 65, as long as you've worked enough quarters in this country, you'll automatically receive Medicare Part A. Okay, and there's no cost for that. But you don't ever have to enroll in Part B until you're ready to leave your group plan through your employer. You can stay on that plan till you're 75, 80, it doesn't matter. You can, as long as you're on that group plan, you can stay on that group plan. And once you decide to go onto Medicare, you'll actually have a guaranteed issue window, because as long as you're coming from what we call creditable coverage, okay, you've got creditable medical and drug coverage, you actually qualify for a supplement plan just as if you had turned 65 and you had that guaranteed issue window. It's the same when you're coming off a group plan. So the answer is you don't have to take Medicare if you're on your group plan through your employer and you're happy with the coverage. Stay with it. Now, it's really a cost-benefit analysis, because what I've found is that most of the time, my clients are actually better off taking Medicare because it provides better coverage at a similar or maybe even a lower cost. So everybody's situation is different, because everybody has different group medical plans. Everybody has different deductibles, different maximum out of pockets, different co-payments. So really, you really need to speak to an agent that can help you make that cost benefit analysis so that you're making the right choice.
Okay, if I didn't change my Medicare Advantage plan during AEP, am I stuck with my plan until the next AEP?
If you didn't change your Medicare plan during AEP, you actually have another window. It's from January 1st until March 31st. It used to be called the Medicare Advantage disenrollment period, because well, I won't get into the reasoning, but it's another window that opens up. We call it OEP, open enrollment period, which was different than AEP, which is October 15th to December 7th. Open enrollment, or OEP, is January 1st to March 31st. And that gives you the opportunity to change your Medicare plan, your Medicare Advantage plan. If you felt that you made the wrong choice during AEP, you've got OEP, the open enrollment, that window from January 1st to March 31st to change that plan. So that OEP gives you that opportunity to change that plan. And then of course you're in that plan until the next AEP, which again would be that coming October 15th. Just remember, anytime you sign up during that AEP, your coverage always starts on January 1. That new plan always starts on January 1st.
Okay. If I am eligible for Medicare due to my disability, can I enroll in a Medicare Supplement or a Medicare Advantage plan?
If you're on disability, and it's usually when people are disabled for 24 months, and let's say you're collecting SSDI, I think it's on the 25th month, you're actually given Medicare Part A and Part B. And then at that point, the answer is yes, really, you can enroll in a supplement or a Medicare Advantage plan, but here's the problem. It's almost cost prohibitive to enroll in a supplement plan at that point when you're on disability, because the premiums are extremely high. They could be $700, $800, $900 to $1,000 a month. So it's not cost effective to take the supplement. What I advise my clients is take the Medicare Advantage plan, because there's a zero plan premium. And then once you turn 65, then you'll have that guaranteed issue window. Then we could apply for the supplement, and we could guarantee to get you that supplement plan once you turn 65. So the answer, again, is the short answer is yes, you can qualify for either or, but in most cases, I won't say all cases, because I do have some clients that are okay paying $1,000 a month because they were actually paying more through their employer's retirement benefits. So, but I would say most of the time, okay, you're better off taking the Medicare Advantage plan when you're on disability and you've got Medicare A and B. Definitely better off with the Medicare Advantage.
Okay. What is IRMA? And I'm going to spell this out for everybody out there. So if you're watching this via YouTube, then make sure that you understand that's IRMAA. And if you're with the audio portion of our broadcast, it's IRMA, IRMAA. What we encourage you to do, folks, when you're watching or listening to these broadcasts, is please have a notepad and paper. I can guarantee you that if you listen to it the first time, you'll certainly want to go ahead and take notes. And if you're watching it the same way, you'll definitely want, because this is useful information. So with that said, Gary, what is IRMA?
IRMA, okay. IRMA is actually my grandmother. No, I'm just joking. IRMA is actually an income-related monthly adjustment amount, and essentially what it is it's a higher amount that people in higher income brackets have to pay for their Medicare Part B and their Medicare Part D. So it's again, income-related monthly adjustment, right? Because when you're in those higher income brackets, you're going to be forced to pay more than that standard $148.50 per month, which is what let's say that's the standard Medicare Part B premium. But there is a chart that your agent can review with you, and your agent can let you know exactly what you can expect to pay for that Medicare Part B premium based on your income, based on whether you're a single filer or you're married filing jointly, and whatever the case is and whatever your income may be, your agent can help you figure out exactly what that Medicare Part B but Part B premium will be. And many people do, it's a good thing, really. It's, it means they're making they have a high income in retirement. That's not necessarily a bad thing, right? I mean, that's our goal, right? So the government feels that if, at a certain level, they're making you kind of ante up a bit. But that is IRMA. It's an acronym. And again, once again, it stands for Income Related Monthly Adjustment Amount.
Okay, so how would Medicaid affect my Medicare coverage if I am eligible for Medicaid or other low income benefits? So another interesting acronym, as you call it, would be low income benefits. So why don't you go ahead and clarify what that means, Gary?
Okay, so how would Medicaid affect your Medicare coverage? Yeah, Medicaid, if you're eligible for Medicaid and Medicare, you actually have phenomenal coverage, because essentially what Medicare doesn't pay, Medicaid picks up the tab. So like IRMA, when people have to pay higher amounts for their Part A, their Part B, and their Part D premiums, right? Because they have high income. This is the reverse. This is for people with very low income. So they need help. So when you have a Medi plan, again, meaning Medicaid and Medicare, you actually have a really great plan, which is, if it's a Medicare Advantage plan, it's and usually people that have Medicaid and Medicare, almost all the time, usually take Medicare Advantage, because obviously if they're in a low income bracket, they probably can't afford to purchase a supplement and a Part D, right? Because remember, you're paying for this. The supplement has a cost, and so does your standalone Medicare Part D. That also has a cost. So these people need help. So not only are the co-payments typically zero across the board for doctors, for specialists, for urgent care, hospitalization, inpatient, outpatient, MRIs, CAT scans, blood work, x-rays, it doesn't matter. It's typically zero cost across the board. They also, through the they probably also have the LIS, which is another acronym. It stands for Low Income Subsidy. So they probably also have the LIS, and that's offered by the state here in Florida. And that they actually cover your Medicare Part B premium. So they pay your $148.50 for you. And they also give you a very hefty drug subsidy, where I think the highest cost for a medication would be like, I think it's under $10, like $9.70. So if you have Medicaid and Medicare, you're eligible. You're eligible. We call it in the business, it's called a dual because it's Medicaid and Medicare. It's called a dual special needs plan. And you can get an HMO. That's a dual special needs plan. You can get a PPO. I typically recommend the PPOs because you have access to larger networks, access to national networks. And then, of course, the low income subsidy is extremely helpful, pays the Part B premium, and it gives you a big drug subsidy. Now, having said that, let me just say that there are some people that don't qualify for full Medicaid. Maybe you're only qualified for partial Medicaid, because there are levels of Medicaid. QMB, QMBI, you can look it up, but basically partial Medicaid versus full Medicaid. So you can be someone that qualifies for partial Medicaid, but then you can also qualify for those LIS, those low income subsidy benefits too, and still get the Medicare Part B premium paid and still get those big drug subsidies. So very, very beneficial for those folks that are dual eligible. Very beneficial. There's a lot of help in these plans for them.
Two more questions, Gary. How often can I change plans if I'm on Medicaid and Medicare?
If you're on Medicaid and Medicare, okay, and again, another good question, Scott, because typically we know that AEP is an annual, right? It's an annual election period, right? So most of us have to wait until that October 15th window opens up, right? But if you're a Medicaid recipient, you have Medicaid and Medicare, right? You can actually change your plan quarterly. Okay, so um, so not only do they get the subsidies and they get the extra help, but they also have the ability to change more often too if they find they're not in the right plan.
Okay. So what is the best choice in Medicare plans when reviewing and new plans being offered during AEP?
The best choice in Medicare plans, well, in my humble opinion, and having been in business over 30 years, or I think it's 32 now, my opinion is that you're always a Medicare recipient, is all a Medicare beneficiary. You have Part A, you have Part B. You're always better off with original Medicare and a Medicare supplement plan and a standalone Medicare Part D plan. And the reasons are obvious. The reason is very simply that you have access to the entire nation of doctors, specialists, urgent care centers, hospitals, and other Medicare medical facilities. So the best choice really is original Medicare for so many reasons. And then, of course, again, if you choose original Medicare, you definitely need the supplement because original Medicare covers 80%. The supplement covers the other 20%. There are some very popular plans here. I like the Plan F. If you're old enough to qualify, they've done away with Plan F. So that's been replaced by Plan G and Plan N. G as in Gary, N as in Nancy. And those are probably the two most popular plans probably in the entire state. Now, a lot of people can't afford that additional, that additional premium that comes along with the Medicare supplement plan. And then there's a separate premium that you would have to pay for the drug plan, the Medicare Part D. So it's not always the best choice for everybody because some people that can't afford a Medicare supplement plan. But if the affordability factor is not an issue, 10 times out of 10, original Medicare and a supplement. That is going to give you by far the best coverage money can buy. Okay. And the widest choice of doctors and facilities. I mean, the last thing you ever want to hear is, sorry, you can't go to that specialist or you can't go to that hospital. They don't take your Medicare Advantage plan. But guess what? They do. Most of them take original Medicare. So with the original Medicare and a supplement, if you were told that, you got to go to MD Anderson Cancer Center, God forbid, with Medicare, with original Medicare and a supplement, you get your plane tickets and you go and you're covered. Unfortunately, with a Medicare Advantage plan, you don't have that kind of flexibility. But again, having said that, a lot of my clients are on Medicare Advantage because even some folks that can afford it just don't want to afford it. They feel that they're healthy enough to, just take the Medicare Advantage plan. And I will say this, that the Medicare Advantage plan, in order to entice people to sign up for those plans, they do offer lots of other ancillary benefits like full dental, vision coverage, hearing coverage, silver sneakers, which covers your gym membership and allows you to exercise in a group setting, gives you over-the-counter money where you can purchase over-the-counter pharmacy items from a catalog. So there are some great benefits with Medicare Advantage as well. So it all depends on the individual. Everybody is different. Everybody has different needs. And a good agent will ask lots of questions and put you in the plan that is most suitable for your particular situation.
All right, Gary. So what I want you to do right now, this is something we're going to be doing more and more as we continue to get closer to open enrollment. And as long as you have your own show, is I want you to give everybody a basic summary of everything you just spoke about the last several minutes so that people know exactly what they want to take out of this broadcast. And I encourage everybody who's listening or watching, okay, please take sufficient notes. This is all useful information. So Gary, give a basic summary on how we can wrap this bad boy up and let everybody know what they should be gaining out of this particular broadcast and any other broadcasts going forward.
Okay, sure. In summary, this is all about the annual election period. So you're going to receive, if you have a Medicare Advantage plan, you're going to receive an annual notice of change. Study that annual notice of change. If the plan has gotten better, that's great. If it still meets your needs, that's wonderful. What a lot of people will find is that their doctor is no longer on their plan. This is the time, this AEP is the time to really speak to an agent that can help you investigate these plans and guide you to the plan, to enroll in the plan that's going to be most suitable. So it's kind of a critical time period because it only comes around once a year. It's a short window. So just make sure that you make the best choice. If your objective is to, get out of your Medicare Advantage plan and go back to original Medicare, or vice versa, you have original Medicare and you want to take a Medicare Advantage plan, again, make sure you have a good agent that understands the business, that can give you the proper guidance during this annual enrollment period. But let me just say that, again, we discussed the annual enrollment and the open enrollment, right? So, I don't want to scare you into thinking that, if you made a bad choice. Remember, you always have OEP, always have that open enrollment to change again, right? So there's a lot of you really have the ability to change. So I guess the big takeaway here is just understand what plan you have, what your deductibles are, what your co-payments are, what your maximum out-of-pocket expenses are, and contact a good agent that's been doing this for a long time that can really help you peel back the onion, really look at this plan and guide you. Maybe you do have a great plan. Maybe you should stay with that plan for the next year, but maybe there's a better and more suitable plan out there for you, and a good agent will be able to guide you into making that wise decision.
Very good. All right. This is the South Florida Tribune podcast presented by Senior Medical Associates. My name is Scott Morganroth. Glad to be joined by Gary Kornbluh. If you want to watch this broadcast, feel free to subscribe to the South Florida Tribune YouTube channel at no cost. All you need to do is just hit the subscribe button and you'll see all the videos that Gary and I are producing. If you're listening to the audio version, you can find this broadcast wherever you go ahead and get your podcasts. Some of the namely ones that we use are iHeartRadio, Spotify, Apple Podcasts, Google, you name it, wherever these podcasts are at, you can find them. Gary Kornbluh's articles can be seen on www.southfloridatribune.com. The broadcast can be found there as well. So, there's a lot of different ways that we can go ahead and get the information. Gary does have a drop-down box as well, where all of his articles are stored there as well. Gary, go ahead, and anything else you want to add before we wrap it up?
Yeah, let me just tell people how they can contact me. Here's my card. Best way to get me really is on my cell phone. It's 561-305-5949. You can log on to my website. It's www.medigapx.com. That's medigapx.com. Click on my testimonials tab. You'll be able to see my many 5-star reviews from my wonderful clients. And that's it.
And Gary's card also happens to be on the www.southfloridatribune.com. If you want to follow us on Twitter, feel free to do so at Tribune South. So let me give you you want to reach us, you can also email us at southfloridatribune@gmail.com. I'm going to go over that information one more time. Okay, if you want to follow us on Twitter at Tribune South, website's www.southfloridatribune.com. Gary Kornbluh there. And once again, feel free to subscribe to the South Florida Tribune YouTube channel. You'll be able to see the video. And again, you can listen to this wherever you get your podcast. So Gary, pleasure having you back on the show again. We're certainly going to be doing a lot more of them, especially as we close in on open enrollment. And I'm looking forward to reading all your articles and taking those words that you put out there and turning them into full-fledged, meaningful broadcasts. So on behalf of Gary Kornbluh, my name is Scott Morganroth. Thank you for joining us on this edition of the South Florida Tribune podcast. Until the next time, everybody, be safe and careful, and please go out there and be safe. COVID-19 is out there. We all need to be very safe from this virus. It hasn't gone away, and it's all about playing it safe and sorry. Thank you very much again for being on. Gary, look forward to your next show. Good night, everybody.
Thank you, Scott. Good night, everyone.